Hello everyone, it's your next day nurse Florence and you're welcome back to my channel where we'll talk about health and wellness in its totality. Today we will be concluding the topic burns. If you haven't seen the first part of the video, kindly click on the I button up here so you can have a better understanding of what have been discussed so far. Without wasting much of our time, let's begin. The seriousness of a burn is determined by 1. The depth of the burn, either first, second, third or fourth degree. The size of the burn, the cause of it, whether thermal, electrical, chemical or radiation, the part of the body where the burn occurred, the age and health of the burn victim and other injuries. The symptoms of burn according to its types. 1. First degree or superficial burn. This extends to the superficial layer of the skin, that's the epidermis. Its symptoms include red and dry skin without blisters. There may or may not be pain, and it usually lasts for up to 3 days. 2. Second degree superficial partial thickness and second degree deep partial thickness. This affects the skin's top and lower layers, that's the papillary and reticular dermis. For the symptoms, the skin appears fairly dry or moist. There's pain, swelling, blisters, redness. There's whitish appearance around the skin when pressure is applied due to decreased blood flow to that area. Healing can take up to 8 weeks and scarring may occur in second degree deep partial thickness. 3. Third degree full thickness. The injury affects all the layers of the skin, that's the epidermis, the dermis and the subcutaneous fat. It also destroys hair follicles and sweat glands. For the symptoms, the burn area is stiff. There is usually no pain in the burn area because the burn damages the nerve endings, causing numbness. However, there will be pain around or adjacent the burn area. The burn skin may be white, black, red with leathery appearance. Healing typically does not occur on its own. 4. Fourth degree burns. This involves injury to deeper tissues such as muscles, tendons or bone. For the symptoms, the burn is often black with slaw or piece of dead tissue, and it frequently leads to loss of the burnt part. How do you prevent burn injury from occurring? We're going to be talking about the prevention of burn injury according to its causes. For electrical burns, you do the following. Use child safety plugs in all outlets. Keep electrical cords out of children's reach. Avoid electrical hazards by following the manufacturer's safety instructions when using electrical appliances. Avoid using electrical appliances when your body is wet. Keep electrical cords or wires out of the way so that children don't chew on them. Replace damaged or brittle electrical cords. If electrical burns occur, call your local emergency number and do the following. Turn off the source of electricity if possible. If you can't, move the source away from both you and the injured person using a dry, non-conducting object like plastic or wood. Do not touch the injured person if he or she is still in contact with the electrical current. Try to prevent the injured person from becoming chilled or cold. Apply a bandage over any burned areas with a sterile gauze or a clean cloth. Do not use towels or blankets because loose fibers can stick to the burns. If the person becomes unresponsive without pulse, begin cardiopulmonary resuscitation. Prevention of thermal burns. 1. Avoid hot spills. Do not cook, drink or carry hot beverages or soup while holding a child. Avoid leaving food cooking on the stove unattended. Do not use tablecloths which young children can pull down. Turn the handles of pots and pans towards the rear of the stove. Unplug irons and put them out of reach. Never leave candles unattended. Consider using flameless candles instead. In case of fire outbreak, have a muster point where you can go to. If not, stay low to the ground. If your clothes catch fire, stop, drop and roll on the ground. Close doors to separate yourself from the fire and smoke. For chemical burns prevention, wear gloves and protective clothing. Store chemicals out of reach, especially for children. If chemical burn occur, remove yourself or the person from the accident area. Wash the injured area to dilute or remove the substance. Wash for at least 20 minutes. Cover the burn with a sterile gauze bandage or a clean cloth. Wrap loosely to avoid putting pressure on the burn area. Wash or flush again if necessary. For radiation prevention, gently wash skin daily with warm water and pat dry. Do not rub or massage the treated area. Use shield to reduce exposure. Keep the skin moisturized and lubricated to prevent itching and cracking of the skin. Do not use perfumes, powders, cream or lotions or deodorants on the skin where the radiation is given. For a person with burn injury, you seek medical help immediately. You go to the hospital as fast as possible. However, if you are in a place or in a country where there's poor medical emergency response, or it will take you hours or days to get to the hospital, you do the following. For first-degree burn, you cool the burn by putting the burn part in cool water at once or until the pain subsides, or hold burn skin under cool running water. Protect the burn by covering it with sterile non-adhesive bandage or a clean cloth. Do not apply butter, oil, lotions or creams to the burn area. Apply a petroleum-based ointment twice daily. Treat pain by giving over-the-counter pain relief. For second-degree burns, cool burns by immersing it into cool water for 10 to 15 minutes. Use compresses if running water is not available. Do not break blisters or apply oil or ointments which can cause infection. Do not apply ice on the burns because it can lower body temperature and cause further damage and pain. If the blisters are broken, wash gently with boiled water that has been cooled. Protect the burn by covering it with a sterile gauze. You can put petroleum jelly in it. Then put the gauze on the burn loosely so it does not put pressure on the wound. Keep the burn as clean as possible. Protect it from dirt, dust and flies. For third and fourth degree burns, you need to seek medical help immediately. But before you get to the hospital, you can do the following as well. Protect the burn by covering loosely with sterile non-stick bandage, or wrap the burnt part with a very clean cloth moistened with clean water. Covering the burn with honey helps prevent and control infection and speeds healing. Gently wash off the old honey and put a new one at least twice a day. For very large burns, the person could go into shock because of combined pain, fear and loss of body fluids from the oozing burn. To help calm the pain, bathe the open wound with slightly salt water. Give lots of fluids to drink. Eat food rich in protein. No type of food should be avoided. If the burn is within the fingers, the armpits or other joints, sterile gauze pads with petroleum jelly on them should be put between the burn surfaces to prevent them from growing together as they heal. Fingers, arms and legs should be straightened completely several times a day while healing. Separate burned toes and fingers with dry sterile dressing if available. For airway burn, do not place pillow under the person's head when the person is lying down. This can close the airway. Have a person with facial burn sit up. Check pulse and breathing to monitor for shock or until emergency arrives or you get to the hospital. So guys, I'm sure you've learned a lot today. Hit the like button to show some love. Subscribe if you haven't done so. Click on the notification bell so you don't miss a thing when I upload new videos. If you have questions or topics you would like me to discuss, kindly drop it in the comment section below and I will attend to them. I'm still your next door nurse and I'm just a knock away. I love you guys. See you in my next video.